Good evening and welcome to the SVG-TV news for Thursday, March 3rd. I'm Khalil Kato with the details. SVG's permanent representative to the United Nations, Her Excellency Rhonda King, has expressed dismay at reports that people of African descent are being subject to unfair treatment while trying to flee the conflict in the Ukraine. Ambassador King highlighted the issue during her statement on the floor of the United Nations General Assembly.
In line with international humanitarian law and its guiding principles, we call on all states to uphold their international obligations and ensure the safety of all peoples. St. Vincent and the Grenadines repeats that it is a stout champion of the purposes and principles of the United Nations Charter and their primacy in our multilateral system. We must, and I repeat, we must give peace a real chance to succeed. We must stop this war and return to diplomacy.
Today, an international coalition of activists and human rights attorneys announced they filed an appeal to the United Nations on the matter. The coalition members said during a press conference they have also received reports of segregated lines for white and black people at the Polish border, and black mothers and children have been thrown off trains. Videos shared on social media have shown groups of black people stranded at the border and not being allowed in, and various threats against those who attempt to cross. At the emergency session of the General Assembly on Tuesday, 144 member states, including SVG, voted in favor of a resolution which required a two-thirds majority to pass. The resolution demanded that Russia immediately, completely, and unconditionally withdraw all of its military forces from the territory of Ukraine within its internationally recognized borders. It also deplored its decision related to the status of certain areas of the Donetsk and Luhansk regions of the Ukraine and demanded that Russia reverse its decision. The resolution also deplored the involvement of Belarus in the unlawful use of force against Ukraine and called upon it to abide by its international obligation. Opposition MP Major Sinclair Leacock on radio today shared his views on Prime Minister Gonzalez's letter to Russian President Vladimir Putin. The Prime Minister was criticized for not disclosing the contents of the letter when he first made it known that he had written to the Russian President. He said it was a private letter, and if he chose to disclose its contents, he will do so in his own timing. However, on radio yesterday, the Prime Minister read the entire letter, in which he appealed to the Russian President to end the conflict with the Ukraine. Major Leacock said, in his opinion, there was no need for the drama surrounding the letter, noting that it should have been handled with more diplomacy.
My considered view that while many Caribbean countries can speak and have spoken to this issue, St. Vincent and the Grenadines has a unique interest into this matter, in that our diaspora community, and here I target United Kingdom, includes a significant percentage of military who are there by our invitation and our promotion. That is our sons and daughters who are in the Navy and the Army. So more often than not, when we are engaged in international discourse and of a military nature, all people, all Vincentian sons and daughters, are on the front line. Flip that script. In St. Vincent and the Grenadines, as they would say in America, we have a lot of military parents who are impacted directly when their sons and daughters have to go on the front line and go to war. So when we speak to that issue, other people speak to it in a generic kind of way, but we stand at the risk of losing bodies.
The opposition MP said it must have been hard for the Prime Minister to address the Russia-Ukraine conflict in his letter to President Putin.
Private letter. No, as it turns out, it's not a private letter. A private letter would be a letter would be on the letterhead of Ralph E. Gonzalez, not the Prime Minister of St. Vincent and the Grenadines. It's a difference. And the letter that we have seen or have been exposed to is a letter from the Prime Minister of St. Vincent and the Grenadines. That's public business. That's public business. And so for a little while he had us holding our hands to make a determination whether his pen pal letter, as some others have described it properly, had a different perspective to the contents of the CARICOM position. Now it turns out that by and large we are in sync with CARICOM, and that's a good thing.
And on radio on Wednesday, Prime Minister Dr. Ralph Gonsalves provided some details on the fiscal summary of the central government operation for the month of January 2022. He highlighted that compared to January 2021, the island is doing much better, but still not as good as it did in 2020, prior to COVID.
This year is much better than January last year. Remember, January last year was a bad month, and you remember I had to come and I was concerned, very concerned, worried that if it were to go on, we would not have been able to pay our bills. Things improved from February onwards. But our January this month is not as good as our January in 2020. The January in 2020 before COVID was a very good January. In fact, January and February and up to when COVID came in March, it looked as though we were going to have an excellent 2020. Things were coming together, and then we had these setbacks now with COVID, and then of course with the volcano and with the volcanic eruptions, and then with Hurricane Elsa storms and the like. We end up with a good primary balance at the end of 2.7 million at the end of January, but not as good as in 2020, but much better than last year.
Prime Minister Gonsalves also noted that in relation to donations compared to the last 2 years, SVG received much more than it did in 2021 and was approximately $4 million shy of what it received in 2020.
Collected in total revenue on grants in January, $47.4 million compared to $38.4 last year. But that's below the 52 million in 2020. So we're about 4 million below the 2020 number, but much better than last year.
PM Gonsalves said although significant growth is expected this year, there are still factors that can alter this projection.
We're expecting significant growth this year, but of course there are downside risks and what's happening. Remember, I said earlier, January this year looks as though it's going to be a good year. I say that we have to look at the following possible downside risks. Remember I said, if we improve our situation with COVID, that's the one, but it's prolonged and get worse. Secondly, natural disasters. Thirdly, that both the public and private sector, that if we don't implement what we plan to do, or capital projects this year, we could have a less than optimal turnout.
The CARICOM Private Sector Organization, CPSO, signed a Memorandum of Understanding with SVG's Minister of Agriculture, Forestry and Fisheries, Saboto Caesar, on Tuesday in the lead-up to the start of the 33rd intersessional meeting of the Conference of Heads of Government of the Caribbean Community in Belize. The MOU establishes a formal structured mechanism for substantive and effective cooperation between the government of SVG and the CPSO for mobilizing and facilitating private sector investments in strategic sectors of SVG. A news release from the CPSO said the principal focus of the cooperation is the realization of increased private sector investment in strategic agri-food opportunities, commencing with a pilot in the development of the domestic poultry value chain with the objective of creating employment, improving standards of living and increasing economic activity, particularly in the rural economy, providing new opportunities for youth and women, whilst providing an acceptable return to investors. CPSO Technical Director Dr. Patrick Antwine, who presided over the virtual signing proceedings, highlighted that the collaborative approach and the commitment demonstrated by the parties were extremely timely. He noted that with expeditious implementations of the provisions of the MOU, there were significant gains to be realized, which were vital for the socio-economic recovery of the OECS and CARICOM states. Minister Caesar highlighted that his ministry and the government of St. Vincent and the Grenadines were extremely concerned about the country's rising food import bill obligations and the impact on food and nutrition security, further strained by the COVID-19 pandemic. The minister advised the ceremony that among the critical elements for assured success were the political will and legislative framework to encourage sustainable investments in the agriculture sector. The minister thanked the CPSO for its leadership to commitment to supporting efforts through its membership and partnerships to mobilize the factors of production such as land and technical support. The initial thrust leading to the MOU forms part of the CPSO's 25% by 2025 initiative, which emanated from a mandate given to the CPSO by the Conference of Heads of Governments of CARICOM to secure greater private sector participation on agri-food import displacement opportunities by 25% by the year 2025 as part of a broader framework to support the full implementation of the CARICOM single market and economy. The signing of the MOU was hailed as a significant step by the region in reversing the trend and mounting expenditure of food imports amidst flatlined domestic production and limited intra-regional trade in commodities such as poultry meat and other meat products. The CPSO said the engagement with SVG will be leveraged with other CARICOM member states. One maternal death was recorded here in 2021, and gynecologist Dr. Damaris Batiste said they have been working hard on improving maternal and neonatal outcomes. Dr. Batiste said that the goal of the OB-GYN team at the Milton Cato Memorial Hospital is to ensure that there are no deaths among mothers and babies in their care.
Death within the first 7 days of life. So we call that neonatal death, early neonatal death. So yes, as I mentioned, we had one death, so our mortality rate is a little higher than we would have liked for this year. But you know, that case was just sad. It was unrelated to any of those factors that I would have mentioned that would have impacted 2021. This was just a very sick patient. And what we have done is work hard to not have any other new maternal deaths. So that means we would be monitoring our patients. We have a lot of pregnant women right now with diabetes and hypertension. So these are comorbidities that always can negatively reflect. But we've done our best to tightly monitor, regulate, deliver early if needs be, and our pediatricians have been excellent in providing support for the babies as well.
Dr. Batiste is urging mothers to seek maternal care very early in their pregnancy, as she noted some risk factors.
Pregnant and you have underlying medical issues, I really want to advise you to get some preconception counseling. Let us know you before, advise you on what to do or what not to do. If you're already pregnant, then you need to ensure that one, there is early booking. You follow all the instructions that is given to you by your doctor or midwife in the community. You do your antenatal labs, you do your ultrasound scan, you keep your appointments so that we can monitor not only your health but also the health of your unborn baby. That would be very important. Take your prenatal vitamins, do any screening investigations that are asked of you. It's important for you to do this so that the outcomes can be improved.
The gynecologist further encouraged healthcare workers to continue doing their best for maternal and neonatal parents.
It is a challenging time, but and a lot has been happening, and it's easy to get very discouraged in this profession. It can seem like a thankless profession where you give your best, but the public only hears of the negative outcomes. They don't see or hear of the countless success stories that we have had. Getting patients out of ICU safely, seeing them come from critical to walking out of here stable. So continue to do your very best. Always think of the patient. Don't get sucked in by the system and the lack of resources. those of you who are disgruntled and tired, I mean, I always say to everybody, just imagine that you are the patient, and if you are the patient, how would you like to be treated? And that's what we need to always keep in our forebrains. Any day, the script could flip. It could be your mother, it could be you as a patient.
Last Friday, the Ministry of Health, Wellness and the Environment hosted its 26th annual perinatal conference virtually. The conference, which is an educational event specifically targeting healthcare workers, is designed to review the perinatal morbidity and mortality figures of the previous year, reinforce best practices, and introduce innovations that can positively affect maternal and neonatal outcomes, thus reducing premature birth, infant mortality, and maternal morbidity and mortality. The theme for this year's conference was New Frontiers in Maternal Fetal Medicine. The National Environmental Day Commemoration Committee joined the global community today in observing World Wildlife Day under the theme Recovering Key Species for Ecosystem Restoration. The World Wildlife Day is commemorated annually on March 3rd to draw attention to the status of our most critically endangered species of wildlife, flora and fauna, and to drive discussion towards imagining and implementing solutions to conserve them. To commemorate the day, a virtual panel discussion was held today, drawing attention to the conservation of endemic and critically endangered species of wild flora and fauna. Referencing data from the Red List of Threatened Species by the International Union for Conservation of Nature, moderator of the panel discussion, Rodika Tanis, said that over 8,000 species of wild flora and fauna are critically endangered.
8,400 species of wild fauna and flora are critically endangered, while close to 30,000 more are understood to be endangered or vulnerable. Based on these estimates, it is suggested that over 1 million species are threatened with extinction. Continued loss of species, habitats, and ecosystem also threatens all life on Earth, including us. People everywhere rely on wildlife and biodiversity-based resources to meet our needs, from food to fuel, to medicine, to housing, to clothing. Millions of people also rely on nature as the source of their livelihoods and economic opportunities. In 2022, World Wildlife Day will therefore drive the debate towards the imperative need to reverse the fate of most critically endangered species, to support the restoration of their habitats and ecosystems, and to promote their sustainable use by humanity.
In his presentation, Director of the National Parks, Rivers and Beaches Authority, Andrew Wilson, explained the terms wildlife, ecosystem restoration, and keystone species. He said the goal of ecosystem restoration is to protect and conserve damaged ecosystems.
The rich array of freshwater, marine, and land ecosystems, as well as nature found in urban areas. And according to IBIS Global Assessment, and this really highlights why we need to have a focus on restoration, and I think why this year the commemoration has this focus on restoration of keystone species. And according to IBIS Global Assessment, they said 75% of land worldwide has been significantly changed, and 66% of ocean and area is experiencing increase in negative impacts, and over 85% of global wetlands have been lost. So there's a clear need for restoration work. However, it is said restoration efforts cannot be effective unless we protect keystone species within these ecosystems, especially those that are endangered. And again, it highlights the role and the value of key species, and the fact that we have to focus on them when we are looking at the restoration of our ecosystem.
Wilson further stressed the importance of ecosystems and wildlife species to humans.
Insects, plants, fungi, and even microscopic organisms that very often is not quite visible to our naked eyes. So for maintaining a healthy ecological balance on this earth, animals, plants, marine species are as important as humans. At least 40% of the world's economy and 80% of the needs of the poor are derived from biological resources. Altogether, food and commercial, forestry, and ecotourism fisheries could lose as much as US $338 billion per year if loss of biodiversity continues at its current pace, based on some information that I saw in preparation for today's program. Also, around 75% of global food crops rely on animals and insects such as bees to pollinate them. But many of these pollinator populations are in decline, which could put more than US 235 billion of agricultural products at risk. So we could see clearly from a dollar value the importance of wildlife in maintaining and contributing to our world's economy. As we look at it from a country perspective in St. Vincent and the Grenadines, and a country where agriculture is important, wild species are of value to agriculture.
The East Caribbean group of companies, ECGC, will be investing 10 million EC dollars in a new flour mill that will see production capacity increase by 1/3 by mid-2023. The company said that they are buoyed by optimism that the Caribbean is emerging stronger post-pandemic and that the new investment is based on its confidence in the OECS markets and wider Caribbean. CEO of ECGC, Robert Cato, said an increase in regional demand is expected and imminent.
This new flour mill investment will increase our flour production capacity by 34%. And so we see export demand rising as the markets recover post-pandemic across the region. Our animal feeds business is strong, and this grew by 15% in 2021. And we are on track for more growth. So I'm excited that we are able to create strong value for farmers, bakers, hotels, restaurants, and homemakers across the Caribbean.
Cato said that in 2021, ECGC launched a growth strategy focused on plant excellence, commercial agility, and profitable export expansion.
In 2021, we launched a growth strategy focused on three things: plant excellence, commercial agility, and profitable export expansion. This new mill and the supporting capital investments are in line with that strategy. And we expect the new flour mill to strengthen the innovation capacity of ECGC. When we look at the Caribbean, we see a clear path for creating exciting baking products and adding significant value to our business. And with this investment in technology, we will double the range of offerings we can provide at ECGC.
Brazilian firm Sangati is expected to supply the flour milling equipment, while the Turkish-based firm Alapala is in discussion to supply the steel structure for the new flour mill.